Patients need to have their vital medical information readily available to anyone in the NHS who sees them. And with the support of NHS South Central and West Commissioning Support Unit, digitised medical record projects are putting the information within easy reach, sharing information with the right professionals when it's needed most. Sasha Herriman reports.
Another busy day at Chessel GP practice in Southampton.
And what was her name?
But alongside business as usual, there's a digital revolution taking place, and NHS South Central and West Commissioning Support Unit is at the heart of it. Here in Hampshire, they've introduced a web-based system to integrate patient health records. Called the Hampshire Health Record, or HHR, it's one of the longest-running integrated care record projects in England, centralising healthcare information systems from hospitals, GP surgeries, pathology labs and community care.
What the Hampshire Health Record does is it joins those up, so actually it takes the information from those systems and stores it in a separate place, and that's then accessible online through a web page, a secure website, to people who work in the health service. And with the patient's permission, anyone who is dealing with that patient can view their record.
The objective is to improve patient safety by making access to their care more efficient and to meet longer-term national plans, with the CSU supporting this initiative. Anne Meader is a patient and carer. She's satisfied the new record systems are secure.
Before anybody can access anything on the HHR, they have to be approved as through their role.
Chris Folk is a clinician and has helped set up the system securely.
There will be situations, particularly in an emergency, where someone may be unconscious and they can't actually verbalise the consent. I think that's where the HHR is very explicit in regards to stating clearly before you see records that you're doing this in context of an emergency and you can't obtain patient consent.
Last year you met Sam, an elderly widower with multiple long-term health conditions.
The new integration has been publicised with patient groups and it's popular from their perspective.
It's brilliant that you can go into one place and access your health and social care records.
The Hampshire Health Record covers 129 GP practices. That's more than 1.4 million people.
Making this next phase of connecting care.
Similar systems are being developed elsewhere in the South Central and West region. Bristol, North Somerset and South Gloucestershire have developed a partnership of 17 organisations called Connecting Care. It brings together the patient details of more than 890,000 people, covering 95 GP practices.
What we've created is a portal that we can put on any PC desktop in the hospital that allows us to bring information from all sorts of disparate systems.
The concept is simple and allows professionals to share details.
Hello, you're through to Clive at Care Direct. How can I help you?
Clive works for one of the partner organisations that helps provide social care. The introduction of integrated records makes his job easier.
The integration of health records has come about over the last 2 years, where via Connecting Care we're able to get an idea about what other services are involved in a person, who is working with them, and so very quickly get a better picture about how best to support that person as well.
Hospital pharmacists are also getting the same benefit.
It allows us to become more efficient and spend more time with the patients, as it can take a fair while to get information out of a GP. Connecting Care allows us to do that at the touch of a button in seconds.
And Connecting Care partners, including South Central and West, have plans for the digital future.
We want it to be richer, full of more information about the individuals that we see. So we want it to cover a bigger footprint and be available to users in different areas, and we'll grow it in terms of functionality.
Long term, I think we will have truly integrated records which share information that is important for the patient, that was managed across the patient wherever they see in whatever setting, and which also the patient will have access to themselves.
That's a record that in future may be accessed by both clinicians and patients, and just one of the ways South Central and West can support local integration of the digital strategy to benefit patients.